Hello, I am Dr. Angela Iponye of St. Catherine University. I'm presenting this study with.
I'm Allyson Green, faculty at Public Health at St. Kate's.
Our research study examined how faith community promoted community well-being during the COVID-19 pandemic. Supporting community well-being requires understanding what individuals and their communities identify as crucial to flourishing and fulfilling their potential. In this study, we defined community well-being as those aspects of well-being that are of interest at the community level. Different attributes of community well-being, such as health and wellness, relationships, inclusion and integration, sense of belonging, and many other factors have been identified in the literature. During the COVID-19 pandemic, faith communities responded in various ways to support the health and well-being of their members and their communities. But some of the work they did was not very well documented. In this study, we wanted to identify key attributes of community well-being from the perspectives of religious people and the role of faith communities in promoting community well-being during the COVID-19 pandemic.
For our methods, we took a convenient sample of adults aged 18 and over who are living in the Twin Cities area in Minnesota. And we ended up with a sample of 11 females, 4 males, and 1 who identified as genderqueer. Ages between 20 and 86 years old, with the mean age of 48. So all of our participants lived in the area and had been here during the whole pandemic. With these participants, we did in-depth, semi-structured, virtual or face-to-face interviews with all these individuals, and they represented a variety of faith backgrounds. After completing the interviews, we thematically analyzed them, and we'll share a few of our results with you. So in figure 1, you can see our results for one theme that emerged, which was what religious people identified as essentials for community well-being. The figure shows a purple triangle in the middle with community well-being and all of these different descriptors that participants identified around the triangle, with different size arrows contributing to how many people made that connection. So starting with meaningful social connections, we had an N of 6, care and support, an N of 5, healthy practices, N of 4, community engagement, N of 3, equal opportunities, and meaningful employment. One person both mentioned those aspects. In addition to these aspects of community well-being, another theme emerged about how faith communities promoted community well-being during the COVID-19 pandemic. Here are 4 examples from things that they describe their faith communities doing: providing tangible support, providing good leadership, providing emotional support, and then promoting a love of dear neighbor. And one example of a quote from a participant for providing tangible support, which 12 people reported. This participant, number 3, says, "I would say one example would be bringing food and healthy food to community members, offering to go to the grocery store for them so they didn't have to go and be exposed to COVID."
Participants reported that having a caring and supportive community, meaningful social connections, community engagement, a sense of belonging, meaningful employment, and equal opportunities were necessary for community well-being. These aspects of community well-being were consistent with the literature. Faith communities provided tangible and emotional support to their members, strictly adhered to COVID mitigation measures to keep their members safe, and quickly transitioned to virtual platforms to support members' social and spiritual well-being. Our findings raised awareness of how faith communities contributed to public health during the pandemic, and also highlighted the need for public health authorities to partner with faith communities in the common interest of promoting public and community health. Thank you.